talk about, to really get the conversation started about infant mortality. The Jacksonville Children's Commission did a disparities report on race and ethnicity, and as we've already really referred to, we have black children who are dying at a higher rate than white children in Duval County. The issue is that we have any children here dying before their first birthday. Again, we had Mr. Talley talking about the young people that he spoke with yesterday. Well, that's because they made it beyond that first birthday. Those were the children that you didn't have to see with neurosurgical ICU. You didn't have to see those children. They had something in their lives that was really important. It made the difference. Fathers, prenatal care, and a village. Let's talk a little bit about the beginnings of all of this. And I would say that would be choices that we make. If we're out and about at the club, this is real talk.
Real talk.
Real talk. We're at the club or car wash, grocery store, and we're shopping and we run into a guy as a woman, and then you get with the guy and you invite him over to your home that same night, and you don't know him. And as we know, many people are not using any protection. Then the next thing you know, the man gets a call 6 weeks later, guess what? I'm pregnant. Let's talk about just that one choice, that one decision that someone made in these days and times. Dr. Montgomery, is this something that you see a lot? And what is behind this?
I guess everyone would agree it's something you see a lot. There's no question about it. And that's why we see teen pregnancy rates, which are just astronomical, let alone other factors that come into play. What's behind it are, again, bad choices, right? And so when you recognize that the choices we make have an impact, as a physician and as a family physician, I oftentimes talk to people about prevention and how it is really important to make sure that you're engaged in protected sex, because if you are engaging in unprotected sex and you give birth to a child or a child is conceived, the likelihood is that that child could become HIV infected or any other of the significant sexually transmitted diseases out there. And then when you talk about just us as men and our responsibility, if we're not engaged in a long-term relationship or if we're not married to that particular individual, the likelihood is that we're not going to be around for the birth of that child. And that just leads to a whole spiral of what we're talking about right now. I think that one of the things that I want the audience to really understand is this whole concept about infant mortality. The infant mortality rate, as you heard earlier in the mayor's proclamation, is really the essence of understanding the health of a community, the health of a population. So in a much larger scheme, we determine how healthy is America or the United States based upon our infant mortality rate. And so then we can ask a similar question, how healthy is Jacksonville based on its infant mortality rate? And given the statistics that we've heard so far today, we know that we are a very unhealthy city when our infant mortality rate exceeds that of the entire nation.